This is our procedure for our oral surgery procedure, and we're doing a basic extraction on tooth number 30. Your tray setup will include your mirror and explorer and your anesthetic. Always include for oral surgery an extra needle and extra carpules of your anesthetic. You will need 2x2s, at least 4, periosteal elevator, straight elevator, a surgical suction tip, a forceps, and your surgical spoon, or also called a curette. We will now begin our procedure by starting with anesthetic. You will dry the space with a 2x2. Make sure to place your light so you can see. And then get your topical. And it will sit on the site for 1 to 2 minutes. When the dentist comes in, you're ready to begin the actual anesthetic part of the procedure. Passing. She will go ahead and numb. And when she is finished, she will recap the syringe herself. Thoroughly do a full mouth rinse. And wait for the anesthetic to take place. Anesthetic has taken place. Please note that during the oral surgery procedure, you are in a standing position versus a seated position. Replace your light, and you will begin by passing the mirror and explorer so the dentist can check that the site is numb. The next part will be the periosteal elevator so that she can loosen the tissues from around the tooth. Then the straight elevator. This is going to actually loosen the tooth from the socket . And then you're going to pass your forceps. While the forceps is being used, you will need to suction because bleeding will start to occur at this point in the procedure. While waiting for the tooth to be extracted, grab an open 2x2. As the dentist extracts the tooth, you will grab the entire tooth and the forceps while suctioning. After suctioning, the dentist is going to place one index finger on each side of the socket and start massaging on the side. While the dentist does that, you want to take your tooth that will be in your 2x2. Verify that it is intact and show the dentist. After that, you will pass the curette in the need that there is any abscess or extra tissue that needs to be removed. After this point in the procedure, while she's doing it, you're suctioning, you will then take 2 2x2 gauze placed on top of each other and folded in half and then folded in half again, placed on the site, and instruct the patient to bite down. That concludes the actual procedure for an extraction. The patient will then continue to bite on these gauze for 30 minutes. You will give them a handout of oral surgery post-op instructions that have some things like no smoking, no drinking from a straw, to take their medication that they're prescribed if pain occurs, and to call us with any issues. You will go over verbally all of your instructions anytime you give a written version of them, so to make sure that they understand before leaving the office. This concludes our oral surgery procedure.